Okay, welcome today to the Women's Heart webinar. We are Fleming Medical and we're headquartered here in Limerick in Ireland. You may recognise our brands, the Medicare Lifesense range, the Medicare First Aid, Foot Care, Infection Control and Home Health ranges, and the Physiologic Sports ranges of tapes and supports. They're all pharmacy exclusive brands and you'll only see them in your pharmacy here in Ireland and in the UK. My name is Teresa. I'm the Key Account Manager at Fleming Medical. I have been working with Fleming's for approximately 3 years, and I am a pharmacy technician with over 15 years retail pharmacy experience.
Thank you. My name is James. I look after clinical training here in Fleming Medical, and I'm also an emergency department nurse as well. So a bit of experience from both ends of the sector here.
So today we're just going to discuss women's heart health, how you can know the signs, reduce the risk. We're going to discuss hypertension, heart attacks and strokes, causes, treatment and prevention, smart health management, and any questions you might have, if you can pop them into the question box and we can answer them at the end. So I'm just going to hand over to James now, and James is going to run through the health stats.
Super. So women's heart health, when we were asked to look at this topic, it's a huge problem. So like any problem, it's always easiest to diagnose the problem first and make people aware of it before we get into the subtopics that are associated with it. But heart disease and heart health affect a huge proportion of women in Ireland, the UK and internationally. In Ireland, a few stats that really stand out are 1 in 4 women will die of heart disease. And in the UK, women are twice as likely to die of heart disease than breast cancer. So really shocking statistics. But with heart disease, a lot of heart disease can be managed at home. And that's what we'd like to do today, is give you the tools, the knowledge and the awareness to be proactive about your heart health at home. When we talk about heart health, a few key topics that jump to mind are high blood pressure, heart attacks and strokes. And we'll start by looking at high blood pressure, how you can manage your blood pressure, what is high blood pressure, and what you can do if you do have high blood pressure. So hypertension is a term that's used in the medical world, and it basically means high blood pressure. And that means that your blood pressure is higher than it should be at a very basic level. If it's not treated and not controlled, it's a major risk factor for heart disease and stroke. So what happens is when you have high blood pressure, is the blood pressure basically means the force that's required from your heart to pump the blood all around your body. So from your bottom of your feet to the top of your head, we need to get blood adequately to every part of our body. So the higher the pressure and the higher the blood pressure is there, the more risk of damage we have to our arteries. When we damage the walls or the lining of our arteries, they become less opaque, they become less elastic, less muscular, and they can become kind of floppy, is probably a good term to describe what they would look like if you looked at them under an ultrasound or an MRI. But blood pressure, your standard blood pressure should be in around 120/80, and we'll talk about the numbers of blood pressure now in a little bit more detail. So your systolic blood pressure is, if your systolic blood pressure is 140/90, chances are you have hypertension. So how do you know when you have normal blood pressure or when you have hypertension? And the easiest way to do that is to record your blood pressure. So in order for us to get any of these numbers, we need to be able to measure our blood pressure. So how you do it, there's lots of means through which you can do this. One is obviously your GP, and the second is the pharmacy. If you call into your local pharmacist, they can always measure your blood pressure for you. Or the third option is to measure it at home yourself using any of our Medicare blood pressure monitors. So what you do, it's a pretty straightforward technique when you know how to do it, but not everybody does know how to record their blood pressure and get the best achievable blood pressure. So in order to measure your blood pressure, make sure you're sitting down in a relaxed position and both feet uncrossed on the floor. And then just make sure that the cuff is well fitted, that it's not loose on your arm. And then the final thing is to apply the position the tube and then basically in the fold here of your arm. And once that's done, rest on a chair for at least 5 minutes without moving or talking. And once that's all done, hit the start button on any of our blood pressure monitors. Wait, the cuff will increase, the pressure will increase in it, and in turn, then it will give you a blood pressure reading. The blood pressure that will read in numbers, and the numbers, probably you would be familiar with a number like 120/80. And in this diagram here, it's a World Health Organization diagram here to show you what the optimum blood pressure is versus anything in the red column there is referred to as severe hypertension, right down to optimum blood pressure. So 120/80 is desirable, and high blood pressure that we've said is a huge risk. If you have consistent high blood pressure, it puts you at increased risk of coronary heart disease and stroke. So what can cause it? Type 1 or type 2 diabetes, being over 65 years of age, use of tobacco or alcohol, have a higher BMI and high cholesterol levels. When we look at them, there's a few things there we can't control, and like we can't control whether you get type 1 or type 2 diabetes, but sometimes you can control type 2. But if you have diabetes, make sure you look after your diabetes. Then being over 65 years of age is a privilege denied to many, and we can't control that. But what we can do is promote a healthier lifestyle. So exercise, a balanced diet, limit your alcohol intake, and reduce tobacco intake will all help you reduce your risk of hypertension. If you do have hypertension and you do pick up a blood pressure monitor, it's reading consistently that it's high levels, just consult your local general practitioner or your pharmacist for further advice. Don't panic. It means you're proactive in managing your health care, and that hypertension can be treated. So the next topic we'll discuss are heart attacks. So we've looked at blood pressure and high blood pressure in particular. Coronary heart disease or heart attacks, basically, everybody will have seen the Hollywood presentation of the severe pain in the chest and the pain going down the left arm. We rarely see it in an emergency department or anywhere else, that really classic Hollywood symptom. There's a lot of very, very subtle symptoms. And if you notice any severe chest pain or anything that's a little bit out of the normal for you, always seek medical advice. Don't just assume it's muscular pain. Always just mention it to people and take it from there. But what a heart attack generally is a plumbing issue. It's a blockage or a narrowing of a healthy coronary artery. When any of our muscle, so our heart is a big muscle effectively, and it pumps in a really nice synchronized manner all of the time. And all of a sudden, one of the coronary arteries that lie all around our heart muscle, if one of them becomes blocked, then we don't have any oxygen supply to that muscle, so the muscle starts to die immediately. So the longer that's left untreated, the less reversal we can do as medics to treat that. So what we basically saying is to always try to be proactive with your health. If you notice any changes in symptoms, to consult a medical professional at all times. So what are these signs and symptoms, and how might somebody know that they're having a heart attack? There's lots of signs and symptoms, from nausea and vomiting to jaw pain, back pain, chest pain, pain in the lower chest or abdomen, shortness of breath, fatigue, indigestion or extreme fatigue, and fainting. So in women versus men, men can also have all of these symptoms, but in women, sometimes these symptoms can be far less obvious than in men. Men can get symptoms that are more severe whereas women can oftentimes present with a slight pain in their upper back or something that you wouldn't directly associate with the classical Hollywood heart attack. So what we're saying is, yet again, if you notice any of these signs or symptoms, to consult a medical professional. A stroke then is the final thing we'd like to talk about, and this surrounds women's heart health as well. So we've mentioned high blood pressure and heart attacks. Both high blood pressure, heart attacks, and strokes are all part of your heart health. And strokes can be directly related to hypertension as well, or high blood pressure. And strokes happen again when the supply of blood to the brain is disturbed or stopped. It can often be like, in certain strokes, it can be like a little blood clot in one of the arteries or the vessels in the brain. So basically what happens is the flow of blood is disrupted and stopped. And similar to a heart attack, once you stop blood from flowing anywhere, the oxygen stops getting delivered to that muscle, and that muscle in turn starts to die off. So how do we know if somebody's having a stroke or a heart attack or what? So with a stroke, you may have seen this acronym called FAST on the side of any of the emergency vehicles or first responder vehicles. I know in Ireland, a lot of our emergency paramedic ambulances have this on the side of them, and it's called FAST. FAST stands for face, arms, speech, and time. So has somebody's face fallen to one side, or is there a slight facial droop? Can the person raise both of their arms and keep them raised? And is their speech slurred, or has there been a sudden change to somebody's speech? If they answer yes to any of these symptoms, it's time to call 999 or 112 and seek further advice from there. Yet again, we break it down into what we'd be looking for outside of these symptoms. So it's facial droop, arm weakness, speech difficulty. Vision problems is also something that isn't in the FAST acronym, but is quite common. And trouble walking or lack of coordination, severe headache, general weakness, disorientation or confusion, and fatigue. Yet again, these symptoms are also very evident in men as well, but a stroke is a medical emergency at all times. But like everything we've mentioned so far, it seems very dramatic that we're talking about the worst case scenarios all the time. But what we're concerned with is keeping people well, and all of these conditions, high blood pressure, heart attack, and stroke, can be managed. And they don't always have to get to that level. If somebody starts to become more proactive with their health and managing their health at home, in the community, popping into your local pharmacist or your GP to get regular bloods done and to check your cholesterol levels, to get your regular blood pressure done, to make sure you're not hypertensive, try to limit your smoking or eliminate it altogether where possible, reduce alcohol intake, and more active lifestyle. So for a hearty health, or for a healthy heart, my apologies, exercise, diet are really, really important. A low salt intake in your diet. These are all controllable factors that will limit us, and especially women in the community, that will limit the risk of developing a stroke or a heart attack in the future. There's uncontrollable factors that are also associated with all of these topics, and they are family history, your genetic predisposition, diabetes, hypertension caused by external factors as well. But if you have a strong family history of coronary heart disease, or a strong family history of heart attacks or strokes even, make sure that your GP is aware of it, and also your pharmacist as well. If that's the case, the uncontrollable factors are also controllable to some extent. It means that you need to keep a closer eye on maintaining good, positive heart health. Then, as we've mentioned, a healthy diet, exercise and regularly checking your blood pressure will go a really long way in preventing you from ever getting a heart attack or a stroke.
Yeah, so just to tie into everything that James has said, I think we've all become a little bit more proactive about managing our own health at home. The last 12 months has taught us all about our 10,000 steps a day, and how that can tie into your overall health and well-being. It's really important that you know your numbers. The Medicare Lifesense diagnostic product range and app allows you to manage your health from home and to get a complete picture of your health. You can measure your blood pressure, your body stats and activity at home. You can save and monitor through the Medicare Lifesense app. You can track those changes and trends and monitor them. And then you have the ability to share those with your doctor or caregiver anytime, anywhere, which is particularly useful at the moment where people are isolating or you have elderly people on their own, and you can help them manage their health at home quite easily. You can manage a whole host of smart health management from the comfort of your own home. You can look at your activity, your blood pressure, you can monitor your sleep, your weight, and even your SpO2 levels. So if you look here in the picture, you have a picture of our app, and then you can see a breakdown of all the products that tie into the app, which allow you to measure your health at home. So one of the examples that we have is the body analysis scales. This is such a good piece of equipment to have at home, because it's not just, as James has spoken about, it's all about your overall health and how your weight can tie into that. And sometimes standing on a scale and seeing a number doesn't give you a complete picture of what's going on. Whereas this scale looks at your body fat, your body weight, your body water, your muscle mass, and your bone mass. And you can track that daily. So if you have a look here, this particular person is 83.4 kg. And if you look, it says on the app that this is pre-obesity. But when you drill down a little deeper into that, you can see they actually have a healthy amount of fat, a healthy amount of muscle, a normal amount of water, and the bone density is actually a little bit high. And this person is carrying 3.6 kg of bone. So the overall number mightn't have made that person a little bit particularly happy, but when you drill down into it, this person is actually quite healthy. Another product that we can talk about is how you can manage your blood pressure at home. It can sometimes be a little bit daunting if your doctor advises you to check your blood pressure from home. The machines can look a little bit clunky in some cases, and a little bit difficult to use and a little bit overwhelming. The basic blood pressure monitor is really, really easy to use, and basic means easy to use, and it doesn't connect to anything on the app, but it can be inputted manually. As you can see, it's 1 or 2 buttons to push, and it gives you clear directions on the cuff as to how to put it on and how to use it. There's also a Bluetooth range of blood pressure monitors, and this ties in with the app as well. So this can help you monitor how you were feeling when you were taking your blood pressure, your body position when you were taking it, which arm you measured on, and you can even add a little note. And this, taken over a long period of time, can give your caregiver or your GP a real true insight into your health and how you are getting on, rather than a once-off blood pressure, which can sometimes, people can suffer from what's called white coat syndrome, which is if a doctor is doing your blood pressure, sometimes it can be a little bit higher, or if it's being done in a pharmacy or a hospital setting, sometimes it can read a little higher. So taking it from the comfort of your own home and giving true readings back to your doctor will give a much better picture of your health. So I can hand it back to James here.
Yeah, and I guess, where do we go from here? So we've already talked about high blood pressure, heart attacks and strokes, and these are all excluding high blood pressure. If you have high blood pressure once off, everything else is what we see as a complete medical emergency, a heart attack or a stroke. But if you're concerned, it doesn't always have to be on the medical extreme emergency side of it. If you're concerned about anything, especially nowadays with COVID, it's really important to consult a healthcare professional, from your local pharmacist through to your general practitioner, or if it's completely out of hours, to attend your local emergency department. With COVID or not with COVID or excluding COVID, whenever we get to that point in our lives, it's always really important to look after your health. Don't be concerned with overburdening any healthcare professional. If you have any sudden change in symptoms or anything you're concerned about, no matter how small it is, phone your pharmacist maybe first, or phone your general practitioner if they're not seeing patients, and if you're not getting an answer, to attend your local emergency department. And that's the biggest point we'd like to say to people is we're not trying to highlight heart attacks or strokes as a means to scare anybody. It's more so the fact that we want to promote good, positive, healthy living, to integrate health management into your healthy lifestyle, and to avoid heart attacks and strokes where possible. And they're all very achievable through regular monitoring of your blood pressure, and getting your bloods done regularly in your pharmacy or in your general practitioner to measure for cholesterol levels. Try and eat a healthy, balanced diet where possible. Limit your intake of salt, and exercise where possible as well. And that's pretty much it. But I'd welcome any questions anybody would have.
Okay, so someone is asking where you can buy the blood pressure monitors and how often they should take their blood pressure if they do have hypertension. So the blood pressure monitors are available in every pharmacy across Ireland and UK, and you'll find the Medicare range in there. If you go to your local pharmacy, you can ask them to contact us. We have an awful lot of information around our blood pressure monitors in terms of our leaflets, as well, just to give you all the information that we have given today, in how to use the blood pressure monitor at home and how to take your blood pressure at home, in the best way possible. So how often should somebody take their blood pressure if they have hypertension?
So hypertension, so what we want to do in promoting blood pressure at home is for you to be in a relaxed environment around the comfort of your own home and also around your loved ones. There's a condition called white coat hypertension or white coat syndrome. And lots of people have it, and it's where you go into your local pharmacist or your GP, and you might be somewhat worried when they are taking your blood pressure. If you start to worry or stress, obviously your blood pressure will increase with that. So that it may not always be a true reading of your blood pressure when you go into your GP or your local pharmacist, because you may have walked 20 minutes down the road or run across the road, you know, when the green light was on or something like that. So what we want to do is go home, take your blood pressure, and do it over say a few times a day. So maybe 3 times a day, a half an hour after you wake up, maybe at 6 o'clock in the evening, and once before you go to bed. And record that maybe twice a week or 3 times a week, as much or as little as you see fit to do. If you're not concerned about your numbers at all, then you might give yourself a 2-month break and then start to record your blood pressure 3 times a day again. And just to keep on top of this at all. There's no limit to how often you should or shouldn't do it, but it's all about doing it when you're relaxed at home, sitting with both feet on the ground, and getting a good quality fitting cuff like the Medicare range there, or any cuff, and record that blood pressure. But it's a different thing. I think somebody asked there about how do you, if you move up there was something about how should I take my blood pressure if I have hypertension. So if you have hypertension, what you'd be doing is you'd be recording your blood pressure at home, in a pharmacy or in a GP, and it would be giving you consistent readings of high blood pressure. So higher than 120/80 for a long period of time. If that's the case, generally what happens is your GP will, or your local pharmacy will give you a 24-hour blood pressure monitor. that will monitor your blood pressure over 24 hours, every 30 minutes for 24 hours. And generally, your general practitioner will give you medication secondary to the results on that. So what we're promoting is just to make sure to check whether you do or don't have hypertension. And if you suspect you do, then you will be prescribed a 24-hour blood pressure monitor, and then your GP will medicate secondary to that.
Yeah, another question is, what's the difference between the A2 and the A5 blood pressure monitors? The A2 and the A5, they are very similar. You can manually put the information into the app. The A5 has a nice colored screen, and it has a silent pump when it's inflating the cuff. And the cuff that it comes with is bigger than the standard size of the A2 cuff. But other than that, they're both really good machines, and they give you really good readings. And you can put it back into the, both can be manually inputted into the app as well for tracking and sharing all your information with your caregiver, or just holding onto it yourself. So
there's a question there about controlling diabetes. I'm not an endocrinologist, but from experience, what you can control is your sugars, and they're controlled by diet and medication. And it's really important to regularly check your blood sugars and really keep on top of your diabetes.
Somebody's asked if we can get your blood pressure taken in a pharmacy if you don't have a blood pressure monitor. Most pharmacies, and we really encourage pharmacies to keep a blood pressure monitor in their consultation room here in Ireland, for people who come in to get their blood pressure taken. Because of COVID, I'm sure every single pharmacy at the moment is different. But if you contact your local pharmacy, I'm sure most are still doing it at the moment, but you may have to ring and make an appointment to go into the consultation room. Usually the blood pressure monitor that they use as well, they sell there. So if you're happy to use it, they might be able to give you the same one to take home as well. So another question is, what equipment works with the Lifesense app? Most of our Medicare Lifesense range works with the app. At the moment, most of our blood pressure monitors, the Lifesense scale, we have a pulse oximeter that is going to be on the market this week or next week, and that's brand new, and that can be synced on as well. So we're growing that all the time. But yeah, any of the Medicare range will go onto the Lifesense app. Is there any more questions there, PJ?
Can you come off blood pressure tablets if you lose weight or get healthier? That's a very loaded question. So no, I can't give you advice on that, but what I can tell you to do is regularly monitor your blood pressure. And if you feel like your blood pressure is really stable all the time, feed that back to your general practitioner or whoever is prescribing you your blood pressure medication, and have that conversation with him or her. It may be a case, it's not always reflective that somebody with a high BMI will always have high blood pressure. That's not always the case. People with a very low BMI can always have high blood pressure, or can have high blood pressure as well. And a lot of the time that can be genetic factors. And it doesn't matter how much or how little exercise you get in, your blood pressure, you have a predisposition to be hypertensive or have high blood pressure. So I would say feed that back to your general practitioner. Can partially blocked arteries, no symptoms, be reduced through healthy diet or exercise? Yet again, this is another question for your GP. I presume, though, in reading that question, that you have partially blocked arteries, and that would have been diagnosed through an ultrasound or a scan of your arteries. So if you know you have it, you may have had symptoms at some time. There's not enough information there for me to give you any sort of an accurate advice or anything of that sort. I'd say consult that with your GP as well. And I'm sorry now for not having enough answers for you. But a lot of the time there's an awful lot of depth to answering any one question like that.
Will your blood pressure monitor warn you if your reading is high or low? All the screens have traffic light color on the side of it. starting at green at the bottom and going to red at the top with some yellow and orange in the middle, and it will flash beside the color to let you know if your reading is too high. You won't get an alarm, but it will let you know subtly that it is too high. Do blood pressure levels change with age?
They do, and they can, and they probably will. They change with the time of day. They change with exercise, but yet again, so blood pressure, if you imagine it, you're lying in bed, and we'll say, for instance, you get up at 8 o'clock every morning. And what's happening there is our heart, as we said, blood pressure is the pressure that's needed to pump blood right from our toes right up to the top of our head. So when you're lying in bed, you can imagine that, and you're fast asleep, your blood pressure is going to be a lot lower now, because first of all, we're lying flat, so gravity isn't against us. We don't need a lot of pressure to push blood up and down our body, and so it's lower. Once we get up out of bed in the morning, our blood pressure will obviously spike because we're doing a little bit more work. You might go for a 30-minute run or whatever you do during the day. So blood pressure fluctuates all the time, with exercise, with movement, with age, always as well. But what we're trying to promote is positive engagement with your health, to maintain a healthy lifestyle. And that's something that when you're relaxed at home, take your blood pressure and just keep an eye on your numbers.
Yeah, I think especially at the moment, because there is a bit of a fear around calling to your pharmacy or calling to your GP. So it's just about taking ownership of your health and knowing what your normal is, and going to see a doctor or to speak to your pharmacist if something is showing that's outside of your own personal normal. That's a good question there. Is there such a thing as your blood pressure being too low? Because I know I have
low
blood pressure.
So what we were talking about is high blood pressure or hypertension. Low blood pressure is known as hypotension or low blood pressure. How would you present with low blood pressure? Generally weakness and fatigue, dizziness. So what you can do for low blood pressure, it can be a problem as well, not as dramatic a problem, lower risk of stroke, heart disease with low blood pressure, but it can potentially damage your kidneys. So what you need to do with low blood pressure, same thing, sit when you're relaxed, in a really relaxed position, take your blood pressure, and then leave the blood pressure cuff on, stand up, and after 1 minute of standing, record your blood pressure again. Then both of them readings, so one when you're sitting, the next one after 1 minute after standing, and if there's a dramatic drop or a rise in that can indicate postural hypotension, or orthostatic hypotension, as the Americans call it, I think. But yes, hypotension, hypotension is an issue generally associated with dizziness and weakness on standing.
Again, I was always told to know what my own level of normal is, even if that is low, and then I'll know if it's high, because if I go to get my blood pressure taken and it's 125/85, that's still within the normal range, but that's quite high for me. So it's just to keep an eye on your own personal numbers again. Can stress contribute to hypertension, James?
Yes, absolutely. A big contributing factor, but it's really hard. Unfortunately, as I mentioned earlier, as a nurse, I can't see stress, and I'm terrible to be stuck in this very medical model of care. But stress does very much contribute to hypertension. And it will increase the heart rate. When your heart rate's increasing, your blood pressure is increasing as well. So try to limit stress. Very easy for me to sit here and say that, but where possible, try to get some regular exercise or whatever might help with stress management.
And how many high readings should you have before you visit a GP is the question there. So that's a really good question. How many high readings? How consistently should you be getting high readings before you should visit your GP? Probably fairly soon. I mean, if you're getting high readings.
So yeah, fairly soon. If you think that you may have high blood pressure, so you're sitting down to take your reading on a Monday evening, we'll say, your blood pressure is high, it's 150/80 or 150/90, we'll put it at. The following morning, you say to yourself, God, I might check my blood pressure again. You check it again, it's consistently above the 140 mark again, but this time it's 160/80 or whatever. If it was me personally, I'd be ringing my GP the following morning just to say to him or her, maybe I should get a 24-hour blood pressure monitor. My blood pressure has now been consistently high for the past 2 days. So that's what I do. But if it was ever anything that you were concerned about, where you had a headache, you took your blood pressure, it was kind of in the high 180s or wherever, a high number that's not consistent with, as Teresa was saying, whatever your normal blood pressure is, if it's not consistent with that, attend your local emergency department.
And should you always check your blood pressure on your left arm?
Ideally, yes, doesn't matter. Some people, particularly women who, if unfortunately they've had a mastectomy and auxiliary clearance of, say for instance, the left arm, then we wouldn't check on that arm, we check on the opposite arm.
If you're doing it at home, it should always be done.
In an ideal world, yeah.
Okay. Can high resting pulse rate indicate something wrong with blood pressure?
It can. No, well, it's a problem with the heart. So I presume what you're talking about is like a tachycardia. So the likes of, I think you mentioned you're getting a new SpO2 meter.
Yep.
They'll have a pulse rate on them, and that will feed into the Lifesense app next week. But what that generally tells you is you may have a condition called atrial fibrillation or some sort of tachycardia. It's a problem with the heart again, but not with the pressure. It's more with the rhythm and the rate of the heart.
Okay, here's a good question for you, James. Do you use an AED on someone who's having a heart attack or stroke?
Not on a stroke. So the indication for use of an AED on somebody is if they're non-responsive. And as members of the general public, or even if you're working in a healthcare setting, if somebody's not responsive, it's not our job in the moment to diagnose them. It's our job to get them responsive. So in all cases, put an AED on. They're all automatic devices. So what they do is an AED will send, there's 2 pads on it, generally speaking. There's one, the upper right quadrant in around here, and the left lower quadrant here. And what it does, no matter who you put it on, somebody who's sitting and talking to you or somebody who's completely unresponsive, it'll send a small electrical current from one pad to the other and check, is there any heart rate, rhythm or activity going on there? If there's no activity, then it might recommend a shock. A stroke, no, you get them straight to the emergency department, ring an ambulance 999 or 112 and say you suspect a stroke. The exact same thing if you suspect a cardiac arrest and you're lucky enough to have an AED, start compressions and use your AED.
Okay, and I think that's all the questions. So unless there's any more questions, thank you all very much for joining us today. We really appreciate your time. If you've anything else that you would like to ask, you can email info@Fleming Medical, and we're available on all the usual social media channels under Medicare First Aid. We look forward to seeing you hopefully at our next webinar. Have a lovely weekend.
Thank you.